Hello viewers, welcome to our channel JD Pharmacoveda. In this pharmacology classification section, let's cover the insulin and oral anti-diabetic drugs with their respective mechanism of action. So the insulin is a hormone that regulates blood sugar levels and energy metabolism. It is produced by the beta cells of the pancreas and released into the blood after eating. The insulin drugs are classified according to the duration of action of the insulin. So the first category is rapid acting. So the drugs are insulin lispro, insulin aspart, insulin glulysin. The short acting insulins are regular or soluble insulin. The intermediate acting insulins are insulin zinc suspension, that is lente insulin, neutral protamine hagedron NPH or isophane insulin. The long acting insulin are insulin glargine and insulin detamir. Then let's discuss the oral anti-diabetic drugs. There are two broad classification with the drugs which can enhance the insulin secretion, and other type is overcome insulin resistance. The first category is which enhance the insulin secretion. The drugs comes under the potassium ATP channel blockers. So this channel, potassium ATP channel, is present in the beta cells. When it is blocked, the cell gets depolarized and which activates the calcium channel and the calcium ions which can stimulate the release of insulin from the cells. So the drugs are sulfonylureas. The first generation drugs are tolbutamide. The second generation is glibenclamide, glypizide, glycoside and glimepiride. Then other category is meglitinide or phenylalanine analogs. The drugs are repaglinide, nataglinide. Then the others are the drug which enhance the insulin secretion are dipeptidyl peptidase 4 inhibitor. So this enzyme which stimulate or which can break the two types of peptides, like one is glucagon like peptide 1 and another one is glucose dependent insulinotropic peptide. So these peptides can degrade or metabolize these sugars. So we have to inhibit this enzyme. So the drugs are sitagliptin, vildagliptin, saxagliptin, alogliptin and linagliptin. Then the other drugs which can overcome the insulin resistance are biguanides. So this is an important category which can activate the AMPK activator, which activates the AMPK. So the drug is metformin. So which activates and it produces many actions, like it can suppresses the gluconeogenesis and it can induces the metabolism in the muscles or the skeletal muscles. Then the other category is PPAR gamma activator, that means peroxisome proliferated activated receptor gamma activator. The drug is pioglitazine. Then the last category is miscellaneous drugs. The first is alpha glucosidase inhibitor. So this alpha glucosidase inhibitor can increase the absorption of glucose in the intestine. So we have to inhibit this. The drugs are acarbose, miglitol and voglibose. Then the another type is amylin analog. So the drug is pralimtide. Then the another drug is dopamine D2 agonist. The drug is bromocriptine. So the dopamine can induces the hypothalamic activity and which can induces the metabolism of the sugars. Then the last type is sodium glucose cotransport 2 inhibitor, SGLT2 inhibitor. This transporter is present in the nephron, particularly in the glomerulus. So when we inhibit this enzyme, it can increases the excretion of the glucose and which excrete this glucose in the urine and it induces the glycosuria. The drug is dapagliflozin. So thank you for watching. If you like our video, please like, enter your thoughts in our comment section, share with your friends and subscribe to our channel.